A scramble to import COVID-19 vaccines sooner rather than later. Government says it expects the first batch to arrive in our country by around April. It's pushing to get earlier stocks for healthcare workers. Once secured, a massive rollout program would target 67% of the population. But what role are big medical aid companies playing in helping to secure vaccines, and how will they be distributed among their members? Discovery Health CEO Dr. Ryan Noach joins us now. Doctor, thanks very much indeed for talking to us. Let's just start very quickly with confirming whether or not vaccines are covered under minimum benefits. What can you tell us there?
Good evening, Devan, and thanks for having me. Discovery Health Medical Scheme took a decision some time ago to fund vaccines for all of its members in full from risk funds, and in fact ring-fenced and allocated funds for that. Subsequent to this, through the activities of the Ministerial Advisory Committee on COVID-19 vaccines, the Council for Medical Schemes is engaged with the sector through the industry associations, both the Health Funders Association, of which Discovery is a member, and also the Board of Healthcare Funders representing some other schemes. And the Council for Medical Schemes, being the regulator, has informed us that COVID-19 vaccination will be made a prescribed minimum benefit, and as such it will be mandatory for all medical schemes to cover their members in full from risk funds for vaccination.
Doc, as we try and secure these vaccines for the country, presumably Discovery would prefer that vaccine in which a single dose is required, not a double dose. And no doubt you were looking into the data and the research of that.
Absolutely. The distribution and the logistics associated with this mass vaccination campaign are simply enormous and require a huge amount of work and focus and detailed planning. A single dose vaccine is much simpler in many respects, but obviously, of course, in terms of the follow-up and ensuring that in that double dosing campaign, the same person gets the same vaccine within the allocated 28 or 30-day period once they've received the first vaccination. So the single dose is much better for any economy and any healthcare market, but particularly also for ours.
I'm wondering what your talks were like with the government regarding vaccines, and particularly with respects to this equitable rollout, distribution and accessibility, because I think Discovery had said before what they would not like to see is Discovery members or medical aid members getting preference over others in the public with regards to getting vaccinated. How are those talks been with government in that regard?
At the outset, we should all recognize, and I think it's an obvious statement, that COVID-19 vaccination is probably the single most important public health intervention of the last century. And as such, it's a national priority and a national imperative. Firstly, for the health of our people, as we see terrible statistics and anecdotal cases of infections and morbidity and some death around us. But also for the economy. It's urgent that we vaccinate as many people as we can so that the economy can recover and then hopefully grow from strength to strength thereafter. So it's critically important that high-risk members of the population are vaccinated first. In this regard, the Ministerial Advisory Committee is giving the Minister, the Department of Health, and us who are participating in the public-private collaboration very good scientific guidance on what prioritization should be adopted. And we have identified the groups of highest risk people that should receive the vaccine first. Critically, whether they're medical aid members or not, it's important that these high-risk members receive the vaccine as quickly as possible across the entire country. The sentiment between private and public through this cooperation around vaccine has been outstanding. There is a real sense of solidarity. We're very proud as medical schemes that we've come to the table and committed our side of the bargain and brought funds to bear and brought capability and thinking to bear. But the Minister of Health is leading a well-orchestrated, well-informed group of committees, including a funding advisory committee, comprised of both public and private representatives that are cooperating brilliantly to ensure that hopefully every South African can get a vaccine ultimately.
I got to ask you before I let you go how concerned you are about travellers heading back from the Eastern Cape or KwaZulu-Natal, the hotspot areas, back to the economic hub, which is Gauteng. Surely this might be of some concern to you, many of them presumably your members.
An insightful question, Devan, and indeed a very, very deep concern. The timing of the second wave of the pandemic has not been good for the country. What's happened is it's peaked in the Eastern Cape and the Western Cape, a short while ago as the migrant holidaymakers arrived there. We're now living through what seems to be nearing, hopefully, a peak in KwaZulu-Natal, but certainly a very large number of infections in KwaZulu-Natal. Gauteng, the inland areas, Johannesburg and Pretoria, are just on their way up. There are a large number of infections there, but it seems very likely that this timing is suboptimal, and that as the holidaymakers return from the coastal areas, we're going to achieve a peak in Gauteng sometime towards the middle or late January. This is very unfortunate timing and a big concern for the healthcare infrastructure and for the people of Gauteng.
All right, thanks very much indeed. That's the Discovery Health CEO, Dr. Ryan Noach there.